I get asked a lot, if I'm already doing Pilates, do I need to do physical therapy as well? And I say to people, it depends, because Pilates and physical therapy are not the same thing. Pilates is a great type of exercise used for stability, toning, strengthening, and flexibility. And physical therapy works on all those same things too, but typically you're going to call a physical therapist when you are having an issue, an injury, or a chronic pain that just won't go away. I'm Dr. Christina, the Picky PT, and today I'm going to explain to you how Pilates and a Picky physical therapy session are similar but also different from each other. Physical therapists are doctors, and they are similar to detectives for your body. You go to a physical therapist when you're struggling with an injury or you're having chronic pain that just won't go away, or you want to prevent an injury. And a physical therapist will take the symptoms that you're having, will take the way that you move and your movement habits and turn that into a diagnosis for you and explain to you why you are having this pain or injury, why it keeps happening, and how to prevent it from happening again. Physical therapy and Pilates are similar in that we use a lot of the same movements in order to gain stability and strength for you. But a Pilates instructor and a physical therapist have different goals in mind for you. A physical therapist is coming at it from an injury standpoint and also from an education standpoint, educating you on how your injuries happen, why they keep happening, and how to prevent it. And a Pilates instructor is going through a class or a set of movements that are typically done together to get a similar flow going for each class, or they might customize it to you knowing what your goals are for toning and strengthening, but not necessarily for figuring out where your injury is coming from. So movements like a bird dog might be appropriate for one person in Pilates, but as a physical therapist, I might not prescribe that because I might feel like that would make your injury or pain worse. And in movements like dead bug might be helpful for one person, but we might need to make it a harder level for another person because of how well they do it, how well they're connecting to their body. And so a physical therapist is going to be able to determine those different levels that you need to be at to prevent injury, to reduce injury, and to educate you on what to use in the future for these purposes. Bird dogs is a common exercise that is given by both physical therapists and Pilates instructors. Now, as a physical therapist, I'm usually going to give bird dogs if I know that someone needs back strengthening in order to increase their endurance for prolonged standing, if I know that they need a challenge for their core that's against gravity, or if I know that they need also shoulder blade strengthening in order to prevent their shoulders from riding up as they're doing shoulder activities. So both a physical therapist and Pilates instructor are going to make sure that as you do a bird dog, you're not twisting or dipping in any way. They're going to make sure that you're not hiking your shoulder up as you do this. And lastly, they're going to make sure that you're not arching your back as you do this movement. We're always going to make sure that you are keeping things level with a pelvic tilt. You're keeping your shoulders out of your ears as you raise one arm. And we're going to make sure that your pelvis stays even rather than rotating. Another common move used by both Pilates instructors and physical therapists is dead or dying bug, depending on how you name it. So this is usually helpful in the physical therapy realm for core strengthening as you are lengthening your body rather than keeping it nice and tight like with a crunch. A dead bug is going to stretch your body out, but you still have to maintain your core stability as you do that. I may give this to somebody if they're having trouble keeping their core engaged as they're standing, more so than when they're sitting. A Pilates instructor will probably use this as part of your core progression in your routine of your class. So both a Pilates instructor and a physical therapist are going to make sure that as you do this exercise, you tighten your core, both lower and upper. You extend the arm and leg without losing your core, and instead holding that tight as you do so. But a physical therapist may get a little bit more picky and look at the bulging in your abdomen, and instead of allowing you to push out as you do this exercise, which can increase back issues, we're going to make sure that that core is pulled in nice and tight even as you lengthen the arm and the leg. One last common exercise that is used both in physical therapy and Pilates is the bridge. Now, this is also commonly used in yoga, but again, like I said, these are all used for different purposes. Oftentimes in yoga, they might be trying to get you to do a bridge with your back arched because you're working on your spine mobility, opening your chest, and getting mobility not just in a rounded way, but an extended way. Whereas with both Pilates and physical therapy, we're really picky about making sure that you roll up through your core as you do a bridge and don't raise past, needing to arch your back. And then on the way down, we usually make sure that you keep your core pulled in as you do so. Now, I am the picky PT, so I do look at bridges in multiple angles. I'll watch it from the side, looking for if you're pulling your core in or bulging out as you do it. I'll look from the other end, your feet, to make sure that you're not spreading those legs as you're doing it, but instead keeping your hips in line. And I'll usually watch from above to make sure that you're not shifting your weight to one side more than the other. As a physical therapist, I'm typically going to give bridges when I need someone to get more glute strengthening, but I also want them to have core strengthening too. And I love to give this as an exercise for folks who are walkers, runners, and are having trouble turning on their glutes. Whereas, like I said, a Pilates instructor is usually including the bridges as part of a routine that they're having a class do. So physical therapists doing the assignment of exercises based on what your issues are and in order to build you to a less injured state. Pilates instructors usually following a routine that they're taking a whole class through, or following a routine that was taught to them of a set of exercises that go well together and is commonly used by other Pilates instructors. So if you're wondering if you need physical therapy or Pilates, my answer would be, why not both? Physical therapists are great for helping you figure out what is my issue, where is it coming from, whether it's chronic or new, and then giving you exercises that are based on getting you out of that pain and then preventing it from coming back. Pilates is great for helping you to maintain that strength and mobility and flexibility that you need to make sure that your pain doesn't come back. I love Pilates exercise classes. They keep people engaged. They keep them in a community with other people. And so I would say, why not do both when you're considering physical therapy or Pilates? I'm Dr. Christina, the Picky PT, and make sure that you like and subscribe to this channel so you can continue to learn the best ways to continue to move, how your body moves most efficiently, and the best way that you can continue to take care of your body from a physical therapist perspective.